Hi, this is Prakash. In this short video, I'm going to discuss about a question, that is, what is pain? Uh, I think it's an important question because our understanding of pain is a key factor that guides how we manage pain. So in this video, I hope it will be about 6 to 7 minutes. I'm going to discuss about our current understanding of what pain is, and also subsequently see what is not pain too. So for our patients and also we as physiotherapists, pain often means, or almost always means, that there's something's wrong. A patient walks into our clinic and says, reports about their pain, and they want us to find that what is wrong which has led to pain. Now, we as physiotherapists, when we assess a patient, the primary focus of our assessment is to identify what is wrong. That our fundamental assumption is that there is a tissue damage that occurred, and so our assessment focuses on identifying the location of tissue damage and which structure is damaged. And commonly, the reasons that is proposed or assumed for the tissue damage is it's due to a malalignment of a joint or other musculoskeletal structure, and there is stiffness either of a muscle or other soft tissue, or as a result of joint degeneration and muscle weakness. Now, this reasoning of tissue damage that is due to these factors is what is guiding our management. That is, our treatment involves mobilization and manipulation to reduce stiffness and improving joint range of motion, strengthening exercise to improve weakness, and other treatment strategies that are targeting to change the alignment into what we consider as a normal alignment. So, like I said, we understand pain, that there's something wrong, that something is due to tissue damage, and our intervention is guided by that understanding, right? So in this picture, it's the classic picture often used, assumed to have used by the French philosopher René Descartes to explain how pain is perceived. That is, you have the fire which is causing tissue damage, damage of the due to burning in that tissue is damaged, and this information of tissue damage is carried by the nerves to the spinal cord and to the brain, where this information is decoded or perceived as pain. Now, the key to this assumption is that the information that goes through directly to the brain, and it is immediately perceived as pain. Now, with this understanding, our treatment is focused on two different principles. That is, in order to stop or reduce the perception of pain, this tissue source of tissue damage has to be removed. And the second principle in the management is that along with removing the source of tissue damage, some of the interventions are also directed into interfering with this information transmission. So that is, if this information is stopped or blocked or reduced from transmitting to the brain, then also pain can be reduced or stopped. And as you know, most of our electrotherapy modalities works on that principle of stopping it from stopping the information from reaching the brain. At least conceptually, that's the focus. Even many of mobilization and manual therapy, physiological explanation for its mechanism also involves stopping it, using gate control theory and so on. But the question here that I want to raise is that, is it always true that pain means something's wrong, right? This is an important question. That is, whenever there is a tissue damage, does it always lead to pain? On the other hand, is it possible when there is no tissue damage but patients may still perceive pain? Now, this question is important because what I am suggesting, if that is true, that is, pain is possible without tissue damage, and with tissue damage it is possible to have no pain. Now, if this is true, now our entire management principles has to be rearranged, because which is based on a fundamental assumption that pain always means that there is a tissue damage. Now I'm going to show you a video and then just to bring focus to the point that I'm raising, and we'll come back and discuss this particular issue that I'm raising. Now watch this video carefully. This video shows a doctor is using his strategies, interesting strategies, to give an injection to a child, right? We may have seen many times, we know what would be the response if a doctor puts an injection to the child, but just watch this video and I have a couple of questions to ask. Here we go.
I'll take the thumb. Are you kidding me?
Okay, now you have seen the doctor is successfully managed to give that injection to the child, and the child was smiling, or at least it's not crying. Now there was a tissue damage, that is, the skin is punctured and some muscle fibers might have also been punctured. And why the child did not cry? That is, according to this model, why the tissue damage did not go to brain and automatically perceived, right? So this is the point I'm raising, where in this case there was a tissue damage but pain is not perceived. On the other hand, it can also be true that where there is no tissue damage, still pain can be perceived. Now, one of the well-known example is phantom pain. Now, in phantom pain, there is even without a particular body part, that is tissue, that the patient still perceive pain. Now, this understanding of pain is in contrary to our existing understanding of pain, which always says that pain means something's wrong and we have to fix what is wrong. But now pain can also mean something. Pain is possible even when there is no tissue damage, and also it is possible that even when there is tissue damage, you may not have pain. I hope you're getting what I'm trying to explain, right? So this will have to change our understanding of pain, because now it's more broader, right? And therefore it will also has to influence how we manage pain. Now in the remaining part of presentation, I will put further, probably in another couple of minutes, in terms of what actually pain is, how the definition or our understanding of pain has broadened. Now there are several experimental evidence. I'm just putting in one small experimental evidence. This is the brain areas that are activated due to painful stimulus. You have one group of patients. This is first patients. These red areas are the areas what we call pain matrix, or the different parts of areas that are involved in perception of pain. That is including thalamus, and limbic system, sensory cortex, and so on. The red areas. The blue areas are the areas that are activated in a group of patients who actually felt pain for a painful mechanical stimulus. And this, in this picture, you can see is that same again, the red areas represents the areas of that are commonly associated with perception of pain. The yellow areas, or the areas which are activated in patients who did not feel pain. Now, this is again an example to show that the area may be activated, that the information might come to it would come to brain, but still it may not be perceived. So this explains that the tissue damage information is important, but it's not sufficient for patient to perceive pain. Like you have seen in that child, for that child the tissue damage information might have reached the brain, but this child did not perceive the pain. Now within that video, most of you can easily recognize what might be the possible reason, because the child was enjoying that play, the song the doctor is singing and playing the child. So it is possible the child felt that the even injection as part of that play, or the child is distracted by the games the child was playing. So pain is not perceived. So this is an important information that we have to understand, that if the distraction or the child, the distraction can modulate pain, or if the child may not perceive the pain. So this is an important understanding in how pain can be modulated, or that everything that reaches brain may not be perceived. So I'm proposing this. It's not I'm proposing. This has been proposed. I'm just going to explain that pain from a larger context. We have to see pain as part of brain's defense system. That is, our brain uses pain in order to protect the system from dangers, any threat that coming from external or internal. Right. So this defense system, I've identified that as it has three important functions. That is, the brain has to detect a threat, and that threat has to be perceived, and then based upon the perception of that threat, a response will be sent. Now, this threat detection is what the tissue damage, that something is wrong. Now, this threat may not be actual. Sometimes it can be a potential threat also, that the brain may perceive that there is no actual tissue damage, but it is possible based upon it is possible that there may be a threat. Now that is, the brain is predicting that there is a chance that there is threat. So both actual or potential threat is detected, and this detection also depends upon multiple factors such as past experience, knowledge, belief, even anxiety, fear. All these multiple psychological and sociological factors can influence how our brain perceives threat. Right? So even when there is a tissue damage, in a previous example, the child did not perceive, because many of the factors I just explained might have influenced that detection. Now the second part is, even if there is a threat detected, tissue damage detected, it will not automatically perceived by the brain. This is a common mistake many clinicians make, that there is tissue damage, it will be felt as pain in the brain. The brain analyzes the information, it interprets the information. There is a tissue damage, yes, but is it really a threat? Right? Then again, these informations, these factors are used by the brain to interpret the incoming information. So if there is a past experience that, say for example, people who are athletics, people who are athletes who are playing the game, they might get slightly injured, but if their past experience suggests that it's okay, it's commonly happen and it will heal very quickly, then if their past suggests that, and they may not perceive pain. On the other hand, if somebody had a bad past experience, even with a past experience, then they might perceive more pain, which may not be directly related to the proportion of tissue damage. So both is possible, and that's why this particular function is important. And I think most of our understanding misses this particular perception. The threat detection has to be perceived. It's not an automatic process, it's a conscious process, keeping multiple factors in mind. And the third is the threat response. Now this threat response, one of the response of the brain for the perceived threat can be pain. So we have to understand this. That is, brain's output is the brain based upon the detection and perception. That's the third step. It's not an automatic step. Then both these previous steps can be influenced by these factors. And if this factor suggests that there is an actual or potential threat, then the brain creates pain, and that pain will protect the system. Staying away from the tissue damage causing organisms or circumstances, and therefore the threat can be detected. And other responses can also be, that is other than pain, there are altered behavior, physical behavior change, avoidance, and many other outputs are there. So therefore we have to understand this. The quote by Professor Ramachandran, who has worked extensively on understanding phantom pain and so on. That is, the pain is an opinion on the organism state. Remember, it is the opinion is the key word. That is, it's a brain's interpretation of it. It may not represent the actual state. Brain interprets based upon past experience, knowledge, and its current psychological status, such as fear and anxiety and so on. So it's the opinion on the organism state of health rather than a mere reflexive response to injury. This is how we, the conventional understanding is that we just see that it's a tissue damage, it's a response, it's pain, right? So brain gathers this evidence from many sources before triggering pain. So this is the key understanding that I want you to have in order to understand pain. So this perception of tissue damage is modulated by a number of cognitive, emotional, and sensory inputs. Now, to understand what are these factors that modulate is very important for physiotherapists, because we can try to manipulate these factors because it can modulate pain. Remember, it can modulate in both ways. It can make pain worse and it can make feel pain better. So if we know how these factors can influence or modulate pain, and that would be key for us to come up with better management strategies. And this is also I thought important for us to recognize what is not pain. That is, whenever patient is having pain, we shouldn't be looking and searching for where is the tissue damage, which tissue is damaged, and so on, because like I have been explaining so far, pain is not always an indicator of tissue damage. And the second is also true, that there is no direct proportional relationship between extent of damage to perception of pain. That is, a patient who is having severe pain does not always mean there was more damage there. Again, the factors which I said modulating can make the pain perceived more or disproportionate to the damage. That is, if the patient is fearful and has a lot of anxiety, and he may perceive more pain which is disproportionate to the tissue damage. So this is so based upon this, many people may not understand this definition of pain. The current definition of pain includes what I have just explained. That is, it is an unpleasant sensory and emotional experience. Yeah, remember, the key word is that it's an experience associated with actual or potential tissue damage. That is, when the brain perceives that it could damage, then also it can be perceived as pain. So the point here is, which I want to re-emphasize again, pain means something wrong. So that understanding, I'm not saying that is poor understanding, but that what is wrong need not always be in the peripheral tissues. The other factors, modulating factors, psychosocial factors, and perception, even if that is wrong, then pain can be perceived. So this gives us a broader understanding of pain, multidimensional. Hope you have understood what I was trying to explain. But if you're having any questions or need clarification, please contact me at this email ID. Thank you for listening.